Hi, this is a walkthrough of the January 2018 Unit 3 exam paper for Health and Social Care OCR Technicals. We'll kick off by looking at the very front cover and to point out some of the factors that you may not have had to consider before, having never done an exam. So, on here you must use black ink, and that's for the reasons of being able to scan it properly into the computer so that when the examiners actually see it and it appears on screen, it's readable. If you use blue ink, it can be a little bit faint, and if you use pencil, we've got no chance of seeing it, so stick to the black ink. In this paper, unlike some subjects, you are expected to answer all of the questions that are set, and this tells you that the total mark for the paper is out of 60 and that there are 12 pages. Make sure that you have answered something on each of those 12 pages and that you haven't had a page that's got stuck together so that you've ended up missing something. So on your desk there should be some information with your centre number and your candidate number on that. So I'm going to fill this in, not in a highlighter, with my name. And I'm breaking all the rules because I'm using purple. Okay, our centre number and our candidate number, which should be on our desks. I'm going to put 4 X's for mine because I don't have a candidate number. And then it wants your date of birth, which is different to a number of other papers. So on this one, I'm changing my date of birth. Okay, 1st of January into the millennium. I was a millennium baby, we wish. Okay, so let's have a look at the questions. I would recommend that the first thing you do is you look through the paper, read it through, and try and answer the simple questions first. Then come back and focus on the more complicated questions. Remember, this paper is an hour and a half. Usually you're looking at roughly 1 question per minute. But you've got 90 minutes here and only 60 marks. So you do have a little bit more time to focus on those long answer questions. So, starting with question 1 then. 1A, one key aspect of the Data Protection Act, I'm going to highlight that because that's the act that we're actually looking at, come on, play nicely, is that information must be kept safe and secure. Then we have a command word, identify. 2 other important key aspects of the Data Protection Act. So you can't give safe and secure, but you can give anything else from the Data Protection Act that you can remember. Now remember, I said when you're looking at these legislative acts, try and learn 2 to 3 points from each of them, because that generally is what you will need to get the marks on these type of questions. So in here, Data Protection Act, we could say data must be used fairly and lawfully. So data must be used fairly and lawfully. Okay, that's going to get us 1 mark. Identify questions are quite nice because they're only making a short statement. And another one that we could have, not being able to be transferred outside the EU. So data must not be transferred outside the EU. And that's because outside of the EU they may have alternative legislation in place that maybe isn't as strong as ours, so it could leave you at risk of your confidentiality being breached or your identity stolen. Okay, 2 marks given. There are other things you could say, for example, not keeping it for longer than necessary, handling it according to people's rights, giving permission to be able to share that data, and remember that in this case we can request information under the Data Protection Act, and it should be accessible to you as the individual. You may have to fill in a form for that, but it is possible. Okay, question 1B then. In a GP surgery, a filing cabinet is left open and unattended by the receptionist. The cabinet contains files with patient contact details. Explain why this is bad practice. So our command word here is explain. and we know that explain means we want a how and a why. Okay, now there are 3 marks on offer here. For 3 marks you need to have a full and detailed explanation and a clear understanding of how the bad practice is demonstrated. What you're not looking for is a list of everything that you could say here. It's not points being awarded on the basis of having 3 bits of information. It's having 1 piece of information with extra points, sort of explaining that instead. So what could be the reason for this in terms of the patients? So we need to make sure we refer to the patients and we refer to the fact that it is a GP surgery. So the biggest problem here is going to be it puts patients at risk. So you could say it is bad practice because it puts patients at risk of abuse or harm. So we know that that is one of our patients' rights. We did that in Unit 2. And we have to now explain why that could be an issue. So for our explanation, I'm going to just switch it into a different colour so it stands out. So we could say, if the person who accesses it uses the patient's information, such as their address, their medical history, what medication they take, then they could use that information against the patient. There's also situations where it may be that the patient is put in danger if they're a victim of domestic violence and that the person accessing their details is their partner and they've found their address when they've had to be moved because of this situation. So it's important that only the people who need to see data actually do see that, and that comes under the patient's right to confidentiality. So how are we going to say this? So if the person who accesses the data gains a patient's address or medical history, they could use this information against them. And I think there's enough there for the marks, but just in case, I'm going to actually put down, just as a reminder, about the problem with domestic violence. So if a patient is a victim of domestic violence and their partner gains their address, this puts them at risk. Okay, that's our 3 marks. Okay, we're on to our first long answer question, and this one is worth 6 marks. So remember, when we're looking at long answer questions, they tend to be level assessed responses. This one is 2 levels. So level 1 is 1 to 3 marks. That's a basic description of the consequences involved in this situation. And level 2 is 4 to 6 marks. This is a more detailed description of the consequences based on the issue that the filing cabinet has been left open. So we need to consider those. Now, we're not looking for a list here. If you're giving a list of information, you're not going to be able to give explanations of everything. You must make sure that the consequences relate to the receptionist, which is shown in bold, rather than to the GP surgery. So we're looking for probably 2 to 3 areas of and context, sort of consequences of how this could affect the receptionist. Okay, so describe is our command word. So we know it's not just a simple sentence. Describe the possible consequences for the receptionist of leaving the filing cabinet open. So I suppose the biggest thing is going to be that she could face disciplinary action and a warning, which could lead to suspension or dismissal from her job because she hasn't followed policies on maintaining a service user's right to confidentiality. Personal information was not kept secure, and not only has she breached their rights, she has also broken the law in terms of the Data Protection Act. So the first one I'm going to write is she could be subject to disciplinary action where she is given a warning and possibly dismissed for failing to protect patients' confidential information. Okay, that's one aspect explained. We can carry on from there. So, a patient may decide to make a complaint as their right to confidentiality has been breached. Okay, and this may lead to her colleagues and her managers losing trust in her, but also it may lead to her then having a loss of self-esteem. So there could be issues further down the line for her as well. So the receptionist could suffer from low self-esteem due to lack of trust from managers and colleagues. Okay, we've got 3 points explained. Other things that could be brought up in there could be things like carrying out training in data protection procedures and policy. There could be prosecutions and fines available, but that's only if a patient has been harmed as a direct consequence of her actions. So it's a hard one to make sure that that's in place. I think you would be better focusing more on these sort of areas in terms of the disciplinary procedure, how that affects her. So that's linking back to your PIEs as well, so that's the social and emotional issues, and also in terms of things like the loss of trust. Okay, question D. The manager at the GP surgery has been told about the filing cabinet being left open and unattended. So we have a command word here, explain. So again, we need a how and a why. So it says, explain what actions the manager could take to prevent something like this happening again. So this is looking at it from a management perspective and how they're going to deal with it. Now this question is worth 10 marks, so this is a big question. There are many different ways that you could approach this in terms of answering it, but we need to make sure that we do this in the correct way. So for 8 to 10 marks, that's a level 3 answer. Your answers have to have full and detailed explanation of manager's responsibility for responding to breaches in health, safety and security. For level 2, 4 to 7 marks, you'll have a sound explanation, some reference to the manager's responsibilities, but maybe not that many. And for level 1, this is more of a list or a basic explanation, not really referring to the manager's responsibilities. They are not looking for examples of practices like limiting the number of people that can access the filing cabinet, having more staff or moving the filing cabinet somewhere else. What they're looking for here is specifically what the manager may do in terms of actually managing the incident and ensuring that doesn't happen again in future. Okay, so in terms of steps, we have got, I'm going to make some notes. Investigate. So what does that mean? Okay, so the manager should investigate. They should carry out a review of the incident and identify what went wrong, how are they going to do that? They're probably going to have to talk to staff. They need to determine, was this a one-off? Or if it's regular. Okay. What should they do next? So once they have investigated, they're going to take action. Okay. So in terms of taking action, how could they do that? So based on the findings of their review, they may go ahead and change procedures, change systems, and they may put in some monitoring, some training or supervision for staff. Something that is going to be helpful and can be documented. So, using review findings, change procedures, or retrain staff. Okay. If we're going to change policies or review policies, that could actually be put in as a separate measure in itself. So you could say that they're going to change those procedures, including those that are for keeping patient contact details secure and making sure that everything complies with the legislation. If we're training staff, how are they going to do that? It could be having display posters to remind them after they've had the training as well. So we could fit that into this. I'm going to put it in a different colour. So retrain staff, have posters on walls to remind staff of procedures. Okay, and regular staff meetings, so regular discussions at staff meetings. So it's constantly on people's minds. It's not just something there in the background that gets forgotten about. Okay, what could we do lastly for this? We'd probably end up at the discipline stage. Okay, so if disciplinary is going to take place, this is where you found that the staff are not following the updated policies and procedures. So they've been given a chance to follow these new procedures. If this is continuing to happen, then we may implement disciplinary procedures. So if staff are still not following procedures, the manager may start disciplinary action by issuing warnings and ultimately dismissal if failed to comply. Okay, and that should be enough to get us the 8 to 10 marks. Okay, we're on to question 2. So, describe how the following hazards could affect staff working in a residential care home. So the command word here is describe. We're thinking about the staff, that they're at a residential care home. We're looking for psychological hazards and working condition hazards. So a psychological hazard is something that causes stress or fatigue. So I'm going to write that next to it. Something that causes stress or fatigue. Okay. Working conditions could be environmental things like the temperature, the noise, or having to travel to work. So this could be environmental, e.g. travelling, temp, noise. Okay, so we've got a bit of an idea what we're looking for here. And again, you can bring this back to your pies work before. So start thinking, okay, something that's going to cause stress for each. If it's a description, I'm going to tell them what it is. So that's the things that cause stress and fatigue. And can I give them an example? So something that causes stress and fatigue, e.g. Feeling angry or isolated due to a lack of staff. Working. So I think during the pandemic we've had a lot of staff had a lot more asked of them, things that they have had to do. They've had to cover for absences because people have been sick with COVID. That has put a lot of stress onto people and has possibly caused psychological damage to them. In terms of the working conditions, how could that affect them? So there, it could be that they forget to do something in terms of the standards of care. So they're offering, so e.g. offering a poor standard of care So relate this back to Unit 2, to the values of care that were in place. If somebody is not offering a good standard of care, then it might be something like they forget to provide the medication on time. So by forgetting to provide medication on time. Okay, we've given them a definition and we've given them an explanation to go with that. We've given them an example. Okay, question B. A care worker who is employed in a residential home demands money from a resident for looking after him. Explain the potential impact on both the care worker and the resident. So we've got two ways that we need to approach this question to make sure that we meet the levels. So this is split into two levels. It's a 6-mark question, 4 to 6 marks for level 2, where you will have a detailed explanation of the impact of what is classed as financial abuse on both care worker and resident. In level 1, you may have covered either limited of both of them or only given a list, really. So let's look at how we would answer this. So I'm going to start with the care worker because I feel there's less sort of impact on them at this stage. So the potential impact on the care worker could be that they face disciplinary if someone finds out. Disciplinary action if they are reported, and ultimately that could lead to them losing their job, and it could even lead to prosecution and even to imprisonment. So you can say this may lead to prosecution and imprisonment. And of course, at that point, they're never going to be able to work in that sector again, which would stop them working in the care sector. Again. Okay. One done. So let's look at the individual. So for the individual resident, they may suffer financial hardship because they've given the money to this person, and yet they're already paying for their care to the care home itself. They may feel embarrassed. And lose their confidence and have low self-esteem. So that comes up quite a lot. Okay. They may feel depressed. They may feel intimidated. And if they're feeling intimidated, they may refuse to be cared for, not just by this person, but by anybody associated with that company, which means then that their condition could become worse. And again, we can apply this back to our pies. We're looking at a physical issue, an emotional issue, in both cases here. Okay. Part C, and this one again is another 10-mark question. So here we've been given a piece of legislation, Manual Handling Operation Regulations from 1992. We have to analyse how these regulations promote health, safety and security in a health and social care setting. Okay, so again, level 3 is 8 to 10 marks. Level 2, 4 to 7 marks. Level 1, 1 to 3 marks. You may have this recorded in your notes as the M4, okay, regulations, and what its job is. So the level of detail is what's going to give us the points for this one. With it being an analyse, we're looking at positives and negatives. We've got to have explicit reference back to the Care Act that we're talking about and be factually accurate. Level 1 is going to be a limited response, it's more of a list, and level 2 may have some reference to it and analysis, but not as much as you would expect for level 3. So let's have a look at things that we could do, and you could actually put this from a positive or a negative aspect for most of these things. So the Manual Handling Operations Regulations promotes health and safety. That's its job. How does it do that? Well, it's going to reduce the risk of injury, such as back injuries, to workers or residents. So we're going to say M4 reduces the risk of back injury to staff and residents. Okay, it does this by reducing the need for staff to use manual handling unless it's really necessary. So using things like a hoist instead, assessing whether you need more than one person to be involved in using that hoist, that's going to be there. So we can put into there, where necessary, a risk assessment is needed to reduce the level of risk of injury to the lowest level. What's that supposed to say? Lowest level possible. Okay, so we have actually got 3 points in there. but I just want to approach it from the view of the residents as well. So if staff are confident when using this equipment, the resident's going to feel that they're more secure and more trust in those other people as well. So I'm going to pop that on the bottom. So staff who are trained feel more confident and this in turn means residents build trust in them as a service provider. Okay. So again, as I said, we can go with those against positives and negatives. So we could say if the manual handling regulations are not followed, then there would be an increased risk of injury. So let's just put that on the bottom, so just to bounce it back the other way. So if the rules are not followed, there is an increased risk of injury. Okay, we've got in there, we've got plenty of positives, we've got one negative. That should be enough to score as those marks. Okay, on to question 3. Flying through this paper. So, Alice is a personal care assistant. She works for Craig. So we've got Alice, we've got Craig. Craig has a physical disability. While at the supermarket, Craig slips and falls over. So we're going to identify 2 actions that Alice should take before moving Craig. Okay, so this is more sort of your general first aid. So the first thing you should do in any situation is to assess the situation. So we're going to assess the situation. Okay, this is only an identify, so we don't need to write any more information from there. What should we do next? Well, we could check for the dangers, find out what caused the fall, identify the hazard and remove it. Call for an appropriate level of medical assistance, call for an ambulance if you need one, and stay with him, reassure him until someone arrives. So I'm going to put here, we've assessed it, and in this case we're going to call for an ambulance. So call for emergency services. Okay. Right. Identify, so again identify 2 actions that Alice should take after Craig has received treatment. So once everything with Craig is okay and they know what they're doing and the ambulance staff are there and they're dealing with that, the first thing really would be to report it to the supermarket staff, maybe fill out an accident form. So report to supermarket. I'm going to put the manager as they're the top person to blame, and fill out accident form. Okay, once we've done that, maybe she should inform Craig's family as well. So inform Craig's family or his emergency contacts and reassure him, make sure that they continue to provide care there for him. What we're not looking for here is about reporting it to the CQC, reporting it to the local authority, contacting a lawyer and threatening to sue people. The only other person you might look to report it to would be the health and safety executive, who would investigate. Okay, part B, describe, that's our command word, 3 practices that should be followed by staff working in a school kitchen to ensure food safety legislation is followed. So this kind of fits into your food and nutrition as well as to your Unit 2 stuff. So 3 things we need to have. Well, we need to have staff must take care to make sure that food is treated in a way that makes it safe to eat. So to do that, we need to make sure food is not contaminated. So staff should ensure food is treated in a way that makes it safe to eat. E.g., okay, that could be the use by dates are followed as well. Making sure food is not contaminated. That may be that we don't have raw meat and cooked meats together. Issues with having different fridges for meat and vegetables, things like that. All staff should have appropriate food safety training. So staff should be trained in food safety procedures. Okay, so that would be, what could be personal hygiene in that point. So e.g., let's go with that, personal hygiene measures, spell that wrong, hygiene measures such as hand washing. And in most kitchens they have to have a separate hand washing sink to food preparation sink. Number 3, staff should identify critical points where contamination can occur. So things like work surfaces, cookware, contact with food processing equipment, so they will need to be cleaned appropriately to make sure that they don't, because the consequence of failing to comply with all this is that food poisoning is there and infections are going to be spread. Well, look, we're back to Unit 5. So we're going to say here, staff identify points where contamination may occur, e.g. work surfaces, food containers need to be sanitised. Super. 6 marks. Okay, and we're on the last page. So, question C, another long one, but it's our last long one, so we can cheer then. 7 marks. Describe the role of employers in promoting and enforcing health and safety. So command word here is describe. We've got to refer to the employers. So this is thinking about our Health and Safety at Work Act. So we're thinking here HASAWA from 1974. Okay, and we need to think about how we promote it and how we enforce it, and those are 2 obviously different ways of looking at this. So we'll do promotion first and safety. Okay, by complying with relevant legislation such as Health and Safety at Work Act. Okay, they should ensure all staff are DBS checked and assess any risks to potential hazards to minimise accidents or injuries. Okay, what else do they need to do? Well, they need to provide PPE. So they should provide PPE, personal protective equipment, to all staff who require it. And provide training in its use. Okay, how are they going to enforce this? So I'm going to change colour. So enforce this by inspecting the areas regularly and checking equipment. They should also put consequences in place for people if staff fail to follow those recommendations. So we'll put where staff fail to follow procedures, there will be consequences and possible fines. Okay, and our last question. Give 2 reasons why a safeguarding policy is necessary in a children's nursery school. So this is taking us all the way back to early years. 1, it's a legal requirement. It's part of Ofsted's mantra as well. So it is a legal requirement, and that comes under the Children's Act. Why else do we do that? Well, it's to protect children that may be vulnerable to abuse and harm, and all children are vulnerable. So to protect children from abuse and harm, and therefore maintaining their rights. 2 marks. Okay, now it told us this was a 12, look, we've got Instagram popping up, 12-page paper. So we've been given additional answer space here, and we've been given 4 pages of the stuff. So if you need extra paper during this, be that to plan out your question. Use this paper at the back. If it's just making a plan and you don't want it to be marked, strike it through once you've done it. Cross it out. If you need to continue your question, so for example, question C there, maybe we didn't have enough space, then all you need to do is write the question number and then continue writing. What I would advise you do if you're doing that would be to write at the bottom so that they know where to find it, and that just indicates to an examiner that that's the question where they need to find extra information. Always good practice. So I hope that's helped you to see a little bit about some of the sorts of questions that could be asked about the legislation side of it. Go back, look at your legislative acts, try and learn 2 to 3 points for each of them. You never know which ones are going to come up, but you can see that it's quite straightforward when it comes to actually answering them, as long as you've got those 2 to 3 points.